How do you stop post-nasal drip cough irritation in children? Imagine a child waking up with a tickling sensation in their throat, a persistent cough that seems to come from nowhere. This is often caused by post-nasal drip, which is when mucus from the nose or sinuses drips down the back of the throat. It's a common cause of cough in children, especially when they have colds, allergies, or sinus infections. The good news is that most cases can be managed safely at home with simple steps. Post-nasal drip happens when excess mucus from the nasal passages or sinuses flows backward into the throat instead of out through the nose. This can cause a constant tickling feeling, sore throat, and coughing that often gets worse at night or when the child is lying down. Usually, this type of cough isn't dangerous but can be uncomfortable and disrupt sleep and daily activities. The most common causes include viral infections like colds, allergies such as hay fever, sinus infections whether bacterial or viral, environmental irritants like smoke or strong odors, and sometimes acid reflux. To help manage this at home, start by keeping your child well hydrated. Drinking plenty of water helps thin the mucus, making it easier to clear from the throat. Using a cool mist humidifier in the child's room, especially at night, can add moisture to the air, soothing irritated airways and loosening mucus. Elevating the head of the bed with extra pillows can help mucus drain more easily and reduce nighttime coughing. Saline nasal sprays or drops are safe and effective for children. They help moisten the nasal passages and loosen mucus, making it easier to clear. Gently encouraging your child to gargle with warm salt water can soothe a sore throat and reduce irritation if they are old enough. It's also important to avoid irritants like cigarette smoke, strong perfumes, and dry air, which can worsen symptoms. If home remedies aren't enough, some medical treatments may be helpful. Always consult a healthcare provider before giving any medication. For allergies, antihistamines can reduce symptoms. Newer, non-sedating antihistamines are preferred because they do not cause drowsiness or thicken mucus. Nasal steroid sprays can also help reduce swelling and mucus production in children with allergies or sinus issues. Short-term use of decongestants might be considered in older children, but they are not recommended for very young children due to possible side effects. If a bacterial sinus infection is diagnosed, a doctor might prescribe antibiotics, but most post-nasal drip cases are caused by viruses and do not requiring antibiotics. Mucus-thinning medications called expectorants can sometimes be used in older children, but these should only be used under medical advice. Most cases improve with time and proper care. However, seek medical attention if your child's cough lasts more than 2 to 3 weeks, if they develop a fever that won't go away, have difficulty breathing or wheezing, notice blood in their mucus, or see foul-smelling nasal discharge. Also, watch for signs of dehydration or worsening symptoms. Parents can help by monitoring symptoms closely, keeping track of what makes them better or worse, and reassuring children that the cough usually isn't serious and will improve. Avoid giving over-the-counter cough and cold medicines to children under 6 unless directed by a doctor. Teach children to blow their nose gently and encourage them to drink fluids regularly. In summary, post-nasal drip cough in children is often caused by mucus dripping down the throat from the nose or sinuses. Managing it involves keeping your child hydrated, using a humidifier, elevating the head during sleep, and using saline nasal sprays. For persistent symptoms or allergies, medications like antihistamines or nasal steroids may be helpful. Always consult your healthcare provider before starting any medication and seek medical advice if symptoms are severe or do not improve. With proper care and patience, most children recover fully and feel better soon.